In this tutorial, we're going to be looking at sports massage for ACL rehabilitation. So if you are suffering with ACL injury, then sports massage could be a perfect solution for you. Also, if you've had an ACL reconstruction and you've not really had proper rehabilitation for it, it's giving you aches and pains, and you need a quality therapy to be able to remove those pains, then sports massage can be perfect for it. So what we're going to do is we're going to look at 4 sections. So we'll look at the anatomy of the knee, we'll look at the basic assessment, the goals of the therapy, and then the massage itself. So if you've had an ACL reconstruction and you've been cleared by the surgeon and or physio, then sports massage can be a great solution for you. Also, if you've had ACL reconstruction but it was a while ago and your knee's giving you problems, again, it can be a great solution for you. So what we'll do now is go straight through into the anatomy of the knee. Many people think the knee is a relatively simple joint because it bends back and forward, but what we'll look at here is the amount of ligaments, tendons, muscles that go around the knee that in some respects will need to be treated. So we've obviously got the quadriceps, which are these ones here, and then you've got the quadriceps tendon, the patella, and the patella tendon. Now obviously they're going to be a main focus with regards to the massage because this is where the ACL is, behind the patella. So there's going to be some degree of tightness, tension, and stress in that area. But what we've also got is many other muscles that are going to be aiding the stability of the knee, because when the ligaments are compromised, that's going to compromise the basic stability of the knee. So the muscles and the tendons are going to need to pick up some of that slack that's been taken away by the ligaments. And as you can see by the this is known as the medial view, so the inside of the knee, and you can see you've also got the tendons coming off the hamstring going all the way down. You've got one that goes into sort of the back of the knee, but one that comes all the way down onto the shin bone. And then you've got gracilis and the sartorius tendons. So the muscles are here. So this is gracilis is a muscle on the inside of the leg. Sartorius is a muscle that sort of goes across the inside of the leg, wraps around the quadriceps and goes onto the outside of the pelvis. So all of these sort of tendons and ligaments will need to be taken into consideration as well. Plus then finally you've got the gastrocnemius, which is the muscle of the lower leg. So there's going to be some degree of therapy needed throughout all of these different muscles, tendons, ligaments. Plus you may also have where the operation has taken place and where the scars are, there may well be some scar tissue underneath them, which again will need some work. But that is the basic anatomy of the knee and of the places where therapy would need to take place. When it comes to the assessment of the knee, because if you're working with a sports massage therapist, you've obviously gone through the surgeon and you've possibly gone through a physio as well. So a lot of the assessment would have taken place then with regards to what's required. You may well be somewhere down the line with that as well. So what we would be looking at would be a range of motion, so flexion and extension. Wouldn't necessarily look at any rotation of the knee because there are sort of minor parts of that, but we wouldn't be looking at that. It's mainly just the flexion and the extension of the knee. And then we would just be palpating, which is essentially a glorified name for prodding, but we are looking for things in particular, which would be scar tissue, which could be underneath the scars directly, but also it could be within certain tendons, muscles, and things like that that may have been affected by the surgery. So that would be the basic assessment that we would go through, and then we would obviously measure that as we work through. So as I've mentioned, the goal of the treatments is to improve the range of movement. So we first of all need to discover what it is, and then it would then go about improving that range of movement. There may well also be sort of pain levels if you have experienced pain for a while with the knee after the reconstruction and the therapy that you've had. There may be some pain in the knee. which would obviously be looking to reduce, but also we've got the stability of the knee as well. So there may well be some exercises that would come along with it to be able to stabilise the knee, because the ligaments give a basic stability to the knee, so just essentially hold the femur on top of the tibia from a very sort of basic perspective. Then you've got all the muscles, the tendons, and the fascia that in some respects hold the whole thing together. So when even just one of those materials or tissues is compromised, it sort of offsets the whole system. So we have to make sure we have to rebalance that system, restabilize that whole system. And that can be from the knee itself all the way up sort of quadriceps and up into the hip as well. So we would be looking at that. And again, when we look at the treatment, I've obviously talked about the anatomy of the knee, but the treatment is slightly different, because we would expand away from the knee ever so slightly to be able to create that range of movement and create that stability through the knee. When you come in for a massage or a sports massage, these are the muscles and the tissues that we would be focusing on. So I've talked about quads, hamstrings, gastrocnemius. You've got adductors, mainly the gracilis insertion, sartorius, any scar tissue, and glute medius, glute minimus. So they will go a long way, and as you can see here, you've got the IT band that joins in to the knee here. You kind of got various different fibers that come down through here, so that's going to contribute to the stability of the knee, and that is what the glute medius inserts into. So there's going to be potentially some muscle tightness, muscle tension, knots in there, because that's going to be going across to stabilize or help stabilize the knee as well. Obviously that's on the lateral side. On the medial side, which is the inside, you've got all of the tendons from the hamstring, tendons from the adductor or the gracilis, you've got the tendon from the sartorius, and you've got the patella tendon and all the various ligaments and tendons that join in there. So obviously the main ones would be quads and hamstrings, so we would be focusing on just getting a basic range of movement through there, but then focusing a bit more time on the tendons that come down beside the knee. Now these can be very sensitive, quite acutely painful, because it is just the tendon and then bone directly below it. It's not that fleshy, so they can be quite tender. And then just working through any scar tissue just to break that down, because it is an intermediary tissue. It's not as stable and as strong as muscles and tendons, so we do need to break that down so the muscles and the tendons can in some respects rebuild themselves back properly. So this would obviously happen over a number of sessions. I would be mainly focusing on quads, hamstrings to start with a good focus on the inside of the knee, just to make sure you've got that flexion, extension, and any medial knee pain covered. And then as the sessions progress on, introducing in gastrocnemius, glute medius, glute minimus as we move further away. Plus, what I should say is also focusing on the scar tissue as well. So it's not just a case of coming in, wham bam, thank you man, one session, off you go, you're better. There's going to be a period of time to make that improved and rehabilitate those tissues most effectively. So yes, if you have had an ACL reconstruction and you're in your initial phases, or if you've had it a year, 2 years, 3 years, but you're experiencing pain around the knee, then by all means get in contact and we can get you booked in. So many thanks for watching. My name is Chris from Christopher Holt Training. I look forward to seeing you in consultation and treatment for a sports massage rehab of the ACL.